Hey there! If you're joining us for the first time, maybe you're wondering what SIHI is and what SIHI Talks is all about. We are the Social Innovation and Health Initiative, SIHI for short, pronounced as SIHI, which means upward and forward-looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
Thanks. Welcome, everyone. We're delighted to have you all here today. Please mute yourself, and we have a really fantastic lineup of guests here today. First, we're going to hear introductory remarks from Dr. Beatrice Halpap. She's the founder of the SIHI Network. She's at TDR and has been instrumental in promoting social innovation in health and working with the team and developing and building capacity. So without further ado, over to you, Dr. Halpap.
Thank you, Joe. Thank you, everyone, for joining, for your interest and joining today this talk series. And every time I attend, it's getting better and better, I have to say. Very exciting. Thank you also, Joe, and thanks to SESH, the SIHI Hub in China, for organizing this and the SIHI Secretariat. So yeah, it's been now almost 10 years that SIHI has been established in 2014. And indeed, this is an expanding network. And this network is composed, as we saw a little bit in the movie, of SIHI hubs that are embedded in research institutions all over the world. These hubs are in Africa, and as we heard, there are like 6 in Africa: Ghana, Malawi, Nigeria, Rwanda, Uganda, South Africa. There are 4 in Asia: China, Indonesia, Philippines, India. And in the Latin America and Caribbean area, we have Colombia and Honduras, and they're already organizing themselves as a regional hub rather than a country hub. And quite recently, we have a hub now, SIHI Hub, in Sweden, so in Europe, which is really exciting to see how actually there can be so much synergy in order to liaise and collaborate to embed research in social innovation. So this network growing, the hubs are working together with partners at the local level, at the regional level, at the global level, and together to embed social innovation research so that we can sustain efforts and impact of social innovations. And that's a bit of the value of the SIHI hubs and their partners. There are quite a number of partners working together with those hubs. The research institutions, so those hubs are seen as unique in their position in research institution to be a natural, neutral broker and bring all the different actors of the healthcare delivery and healthcare system together, and also intersectoral, so government bringing also the government, bringing researchers, innovators, communities, private sectors, you name them, So that this is a great power based in the research institution. They conduct effective crowdsourcing to actually identify very effective or promising hubs, and that is through they select them through a very rigorous and due diligence process, and then support those hubs through small research grants, through coaching. There are like some little fellowships organized, visibility, as we will hear as well, in order to advance. And there is also the role of looking at the monitoring and evaluation of such social innovations. So we are seeing such a network growing now today, 13 hubs and many contributing partners. And it is indeed a good time to look at how best to develop strategy to regionalize and see how to synergize efforts and share and learn from each other at the regional level, and then later at the global level. So we are honored today to listen actually our three great speakers and hear from them what are the strategies that we could approach to do that, and what we are testing and approaching. Thank you very much, and over to you.
Thank you, Dr. Halpap. Our first speaker today is Dr. Noah Fongwen. He's a research fellow at the London School of Hygiene and Tropical Medicine, and he's also a focal point for innovation at the Africa CDC in Addis. Unfortunately, he had an urgent meeting today and is not able to join us live. However, he was able to rapidly pre-record something, and we'll show you his pre-recording right now. Over to you, Dr. Fongwen.
Hi, everyone. Welcome to this session on promoting social innovation in Africa. I am Noah Fongwen, and I work as a research fellow at the London School of Hygiene and Tropical Medicine, and I'm heading the diagnostic portfolio for Africa CDC, also helping to set up a social innovation hub at Africa CDC. And I'll be taking the next few minutes to talk about how we can promote social innovation, taking an example of the health center by phone. So I'll start by talking about the health center by phone innovation, which was one of the innovations that were identified through a TDR call for social innovations in Africa. I'll talk about some of the things that we did, how LHHTM and Africa CDC collaborated with the implementers of the health center by phone, and how we had support, how we used the health center by phone as a way to support telephone hotlines on a broader scale, and I'll provide some summary key points. So the health center by phone was an innovation that was started by someone in Malawi, actually not a healthcare professional. This is someone who just saw the need to reduce the stress that the health system was already facing, and to provide timely information to people in remote communities, taking into consideration and the advantage that that information could be shared easily using a phone. And so he set up a hotline through which people in remote communities could call or send basic messages to healthcare professionals, and through that they will have advice on what they were supposed to do. And that helped a lot, and was used in aspects like in nutrition, and was used in aspects for general health, and was used in aspects for maternal and child health. And that was taken up and supported by partners like USAID, was supported by PEPFAR, was supported by GIZ, and they supported different aspects of this telephone hotline to see how that could be used for nutrition, that could be used to support different aspects of health that they were interested in. And this has been a success in Malawi, because as it started in a small district, and later has been scaled up through the entire country, and has been adopted by the government. So this is an innovation that we saw as Africa CDC and LHHTM that we could use, that we could promote, and to see how we can expand the application of this innovation to other aspects of healthcare. So the expansion from a single health district in 2011 to a national hotline serving 28 districts by 2018 and final adoption by the government provided us with so much that we could learn, that we could leverage, and use this innovation as an example on how an innovation starting from a small district can be scaled up right to the point that it is sustainable and sustained by the government of a country. So we decided as Africa CDC and as LHHTN to support this program, and we started approaching funders and approaching partners on how we can use this telephone hotline moving forward. So one of the ways we thought of promoting this hotline was to pitch the idea of using the hotline to adapt in other countries and to scale up to see how the hotline could be used in other countries to increase healthcare coverage in underserved communities. This was pitched during the World Health Assembly in 2019, and we also talked about the possibility of transforming the system into a two-way system of communication and applying the hotline in possible disease outbreaks. And interestingly, this was a few just before the COVID-19 pandemic hit the world. So Africa CDC and LHHTM approached the UK Rapid Support Team, which is a group, an expert group dedicated to fighting pandemics, outbreaks all over the world. We approached them with support to see how they could support our work to promote the health center by phone that was used in Malawi and scale up the idea in other African countries in a way that the setup could be used to respond to outbreaks. That was just around the time that the pandemic was raging around the world. And when we approached them, they said, okay, this is a good idea, that this was a very good idea, and that it was not just enough to just scale up the hotline. And they suggested that it would be good to carry out some preliminary studies, broader studies in terms of reviewing and also interviewing people to explore the effectiveness and barriers for telephone hotlines, to understand how effective hotlines were in general. That is, stepping back and looking at telephone hotlines on a broader scale to review their effectiveness and to really understand the role that they play in terms of outbreaks, and also to understand the barriers that the hotline face and also facilitators for sustainability. Because one of the very important things when we have to do with social innovation is to understand how sustainable any social innovation can be. So, as a team, we worked with Africa CDC team and LHHCM team, and were funded by the Rapid Support team to conduct a systematic review on the role and effectiveness of telephone hotlines. What we did was that we had a robust review where we collected all the background evidence, and also apart from the review, we interviewed key informants who were actually telephone hotlines implementers and also partners and funders to understand some of the barriers and facilitators to the sustainability of telephone hotlines. Then from then we learned a lesson on the effectiveness of telephone hotlines in outbreak response, and we understood how hotlines could be set up, the barriers that hotline face in general when they are used in responding to outbreaks. And we have that information that could be very, very useful. We are using right now to develop a roadmap on how a hotline can be scaled up. We are developing a roadmap on the implementation of telephone hotlines across Africa, and using the information we have to develop a robust sustainability model for telephone hotlines in Africa. So what are some of the key takeaway points from our experience in promoting telephone hotlines as social innovation in Africa? We realize that apart from telephone hotlines, there are many social innovations in Africa that can be leveraged to meet the health needs of the continent. And in this particular case, we're talking about how we could support or use a telephone hotline as a social innovation to support outbreak response, which is very important for the health security of the continent. And we use the health telephone hotline as a very good example on how this can be used, how this can be nurtured, and how we can carry out a broader scale study to gather wider evidence on effectiveness of social innovations and the barriers and facilitators for sustainability. And what we realized was that also to better support social innovations, partners and funders need evidence on the role that the innovations can play and the barriers and facilitators to sustainability. And the lessons we've learned from our exploration of the role and effectiveness of telephone hotline, on the barriers and how we can make it more sustainable, we can use these lessons to scale up and develop models of sustainability in Africa, taking into consideration the role that governments and partnerships can play. And thank you. I want to appreciate the support we received from the UK Rapid Support Team, the support from TDR. I want to acknowledge all Africa DC team, Joe Tucker, Appealing, and everyone who really supported us in exploring broadly telephone hotlines and how they can be supported, promoted, and adapted for use in outbreaks, not only in Malawi, but across Africa. Thank you very much.
Thanks, Noah. Our next speaker, we're going to be switching gears, and we're delighted today to have Miss Mengji Chen. Mengji is coming to us she's a technical officer for innovation and research at the WHO Wipro Regional Office. She recently led the development of a regional strategy on innovation for the Wipro office. She's a passionate advocate for innovations of all stripes. Thank you again for joining us, Mengji. Over to you.
Thanks, Eddie. I'm not sure if I'm as passionate as you are, but thanks again for the invitation. And again, thanks everyone for sharing this experience with you. So allow me to share my screen. Let me know if you could see the full screen. Can you?
Yep, looks great.
All right. So I'm not sure how many people are familiar with WHO in the Western Pacific region. So let me just start with this. So within this region, this is home to 37 countries and areas with nearly 1.9 billion population, which never lacks any problem. All of the emergent and threatening issues, as well as long, chronic, lasting problems, you have it all. And you can find it everywhere. And that is so diverse. You have all of the advanced economies in Japan, Korea, and you have the transitional economies like China and Malaysia, Southeast Asia. And you also have the economies without scale in Pacific Islands, 16 to 17. And you also have the almost Soviet-ish Mongolia sitting in, which is closer to the Balkan bloc. So in that sense, the geographic diversity and the cultural diversity may become a very diverse, it's just a hotbed for social innovation. And it also gives rise to a lot of cultural practices in even the smallest economies. And that is a background of this region. I'm just going to give a very short introduction to our team here. It's a very small team, but still we managed since our establishment after actually at the beginning of COVID, our entry point into innovation is actually technology, because we were mandated to do horizon scanning for emerging technologies. And we developed a series of interim guidance to support member states in implementing digital tools. We organized a lot of platforms and forums, but it's during this process, what we realized is if we actually want to implement any digital solutions or technologies, social innovation is actually the key or the process of change, the change management and the understanding and the upskilling of people, and how to actually successfully, effectively manage that change. That's something technologies can never achieve. That was how we slowly realized it's more important to look at innovation not as tech, social, as a dichotomy, but rather to see them as two different forces that are actually coming together, converging, and they're both contributing to the health innovation theme. And as Joe just said, we are in the process of developing a strategy, which I'll come to that later. But before that, I would like just to share a few things about how WHO and government were actually working together. This is slightly different from the previous sharing, which is focusing on one case study. I would like to just share a few examples that where us, as well as the government, are playing different roles within the region. So the first one is actually an example that WHO China office. They worked with a National Institute of Nutrition and a university. And what they did was they used a nudge theory. They used behavior changes approach to try to, they worked with the food delivery app because China is quite big for that. So what the intention is to reduce salt intake by increasing the banner and the small nudges that are custom developed, and the project recruited a set of restaurants that are willing to accept this purpose, which is health-oriented public purpose. And what they did is this recruited restaurants actually started receiving training from the National Institute of Nutrition under China Center for Disease Control. And they got standard training on how to ensure that the salt intake can be reduced, the salt they put into the recipe can be reduced at the very beginning. And they also monitor the intervention as part of this project. The academic institution, Tsinghua University, involved, they designed the evaluation protocol. And so essentially, this is a good example of how the office played a role in brokering partnership between the CDC part as well as the academia. And more importantly, they got the willingness and they managed to convince and negotiate with a commercial platform to make this happen. So this is a pilot project still ongoing. And the second one, Seoul 50 Plus Initiative, it's been there for like more than 10 years. I guess most people who live in the greater Seoul area would have heard of this more or less. But still, this is something that's in the process of being scaled up across the whole country, starting from Seoul city government. So what it does is, for many of the healthy aging initiatives, traditionally speaking, the government focuses on investing in insurance programs and ensure that the aged population can have safety net. But this initiative is looking at people who are early in their aging process and who are yet to retire. Because based on the evidence, based on the studies, what they found was if those who are in their early 50s couldn't find a way to rescale them, there's a high likelihood that this population will fall into retirement poverty. Because that is a context of South Korea. So this initiative, initially introduced by the city government in Seoul, was intended to inspire those who are in their early 50s, who are either forced to retire early, who has a sense of danger and they may need to find a different job, but they are not equipped with the right skill. So this initiative brings together the industry, companies that have the demand, and they also bring together these early retirees and people in their 50 plus to consider a package of a sort of like a menu of tools and skills that they could be trained on. It also provides a campus where these old people can come together and share their learning and knowledge, and they can help each other. This also becomes a venue where they get a different sense of social participation instead of losing themselves after an early retirement. And this project actually redefined aging because they're targeting a different population instead of focusing on providing service and protect people after they get age, which is defined as above 65 years old. So to some extent, this is actually reaching the unreached population. Now it's being replicated in more than 80 different townships, and it's still ongoing process. And this is another project that Cambodia Center for Disease Control worked together with the country office. So what they did was during COVID-19, they work with the country office, took the leadership and brokered again the collaboration between the DOH and also promoted the use of a digital tool that provided one-stop service that initially wasn't available because the background is that primarily in in Cambodia, the access to self-testing service was kind of not prohibited, but sort of challenged because of the stigma and other social factors. And because of our previous practice, which sort of kind of is a success in Vietnam, and Cambodia country office actually replicated this, and they come up with the same thing. But in addition, they also propose the use of a community action approach. And they, instead of just focusing on introducing one platform, they further added a bit of additional service than their Vietnam project example. They train health providers to improve the trust. They also provide a prepaid mobile package, because that's something that in the Vietnam case, which people later realize, this is actually an identified barrier. They also leverage the social media platform for communication and promotion, and there's a feedback loop closed. So a similar thing that's in the Philippines, I actually think I could skip this because the approach is essentially the same. And what I wanted to go forward is just this is a very summary of the roles played by the governments and partners. And again, here, what I'm not talking about is the details of one social innovation story. What I'm trying to focus on is actually how different partners actually work together to bring a thing from an idea into implementation and actually can achieve an outcome, an improvement. So all of these examples that I propose here, the government and the state capacity actually play the role. And this leads to what I wanted to say here. So back to where I begin, this region is very diverse, and we have a ton of different opportunities and also a ton of challenges. And if you look at the list of challenges we identified, the lack of long-term patient funding, and the evaluation and impact, and the evidence for governments to accept and institutionalize any practice, or the communication and application, or the policy enablers, and the lack of regulatory frameworks that encourage social innovation, and the sort of collaboration. So all of these can be addressed, but they can only be addressed when the government can play the role. And that's the anchor point of our regional health innovation strategy. So the whole document is focusing on one thing. Governments need to assume leadership in promoting social innovation, or in general, health innovation. And before I go down to the strategy, which is a bit text heavy, I would like just to give you an idea of the projects we're doing, focusing on in tandem to the strategy development. So while we developed a short, succinct strategy document, we figured we probably should identify a few key case studies where we can see the public sector, the government, the Ministry of Health are playing a major role. And these two are examples. We developed a compendium with stories from multiple governments shared by the national MOH, and we also had a in-depth study, sort of implementation research piece, working together with the Malaysia Ministry of Health. And the case studies themselves are sort of the approach for us to amplify these stories we identify through member states, sometimes with our own involvement as WHO in the regional office, sometimes with simply as amplifying these practices and try to understand what are the common patterns and how different countries actually, within the same cluster, of course, can learn from each other. So finally, let's come to the regional health innovation strategy. It will be presented at this year's regional committee meeting, which is next month, and will seek member states' endorsement, which means health ministers from 37 countries and areas will say yes and express their political commitment to the objectives we put into this document. So there are 3 key objectives, and here I didn't specify social innovation because for us, all innovations are social because they have a social cost, and even all technologies, they will end with social change that we need to adapt to. So in that sense, everything is social innovation. And there are 3 key objectives. One is setting the value and direction for health innovation. The second is strengthen the public sector's capacity to manage health innovation. And the third is to establish enabling ecosystems for health innovation. So in that sense, this strategy is focusing on, instead of scaling up any specific social health, social innovation practice, we try to scale up government's capacity to incubate and identify and scale up more solutions. So this is a strategic framework we put into the strategy document. And the vision we have for this region is governments can exploit health innovation to solve problems, accelerate impact, and shape the future of health and well-being. In that sense, we hope governments can be the value setter and point out the directions for social innovations. And we want them to receive the capacity training they need to be able to recognize what the type of social innovations are supposed to be promoted and how they can actually bring together stakeholders and create an enabling ecosystem where social purpose is mainstreamed instead of commercial profits or motivations. So we also had a set of different actions where WHO and the member states are supposed to take actions. I'm not going to go to the details now. And to implement the strategy itself next few years, the roles of WHO and areas, these are the 4 areas where WHO are supposed to play a role. We will develop norm guidance and play leadership. We will help support countries to establish an innovation ecosystem at this regional level. And we will also develop key capacity building programs in collaboration with partners such as SIHI. And we will also facilitate implementation of specific, for instance, policy implementation to scale up social innovation as a whole. But all of this cannot be done by ourselves alone. And we would anticipate organizations such as SIHI to work with us. And we can just sort of piggyback and build on what's already built. And we'll just be the role. Instead of leading the ecosystem, I think WHO in the region, we are more like to be a connecting dots and bring together all of the possible stakeholders in the social innovation landscape here and cross-pollinate. Yeah, I think that ends my presentation here. Happy to discuss if there are any questions. Thank you.
Thanks, Mengji. That was fantastic. And we'll hold questions, but if you do have questions, feel free to put them into the chat box. We will have time. Our final speaker today is Dr. Luis Gabriel Cuervo. He's a senior advisor at PAHO, and he started as a Colombian family medicine physician and has really been a strong advocate for social innovation within Latin America and the Caribbean, the LAC region. And we're delighted to have him here today and discuss with us how at the regional level he's promoted social innovation. Over to you, Dr. Cuervo.
Well, thank you very much, Joe. And it's wonderful to be attending this panel today. Latin America and the Caribbean are very diverse regions, but they also have many commonalities. And I am relating a little bit here to what I was just hearing from Mengji of that situation and the opportunity that it brings to be to have a regional approach. PAHO is the specialized agency for health of the Inter-American system, and acts also as the WHO's regional office for the Americas. And we have our member states are all the countries of the Americas. And so we have 35 member states plus some participating countries as well. And with those cultural similitudes and issues faced by populations, it also means that there is a lot of exchange and great opportunities to collaborate. And so that's what we're going to be talking a little bit about in the next 9 minutes. I want to acknowledge the partners with whom we work at the regional level, CIDEIM, which is the training center for TDR in the Americas, the Antonio Vidal Institute in Honduras, TDR, and the Swedish International Development Agency, which support our work, and of course the Global Secretariat in the Philippines. We work with governments. We're an intergovernmental organization at PAHO, and our governing bodies that met this week are the health authorities of all member states. So I think that's particularly relevant, as Mengji was pointing out, the institutionalization of social innovations and leadership of governments can be critical in the sustainability of social innovations. So throughout the region, we share very common challenges. For example, addressing the health equity gaps, because our region has some striking inequities. And social innovation has a long story in the region. When SIHI began, initiatives from Brazil and Paraguay were recognized in the first crowdsourcing call in 2014. And in 2017, a regional hub was established for the Americas, led by TDR's Regional Training Center, CIDEIM, in Colombia, with PAHO as a partner. And that year, we organized our first crowdsourcing call. And we have calls every other year with recognitions to innovators given at PAHO, typically during the Universal Health Day in December. The initiative has a continuous improvement that's kind of embedded, and we have an open dialogue, feedback, and design thinking. So there's a continuous review of what is being done and improvement. And I think that's a particularly valuable thing about the way that SIHI works. Innovators, partners, the hubs, and the larger network contribute to research, to living installed capacities, and to advocacy. In the region, SIHI has kind of a federalist approach in which the hubs support structural issues, very much in the same lines of what Mengji was showing. Facilitating, setting standards, it does coordination, due process, leaving room for all to contribute. For example, the Global Secretariat works with partners to produce the SIHI Talks, and in our region, Diana Castro took the lead at the University of Antioquia, which is also affiliated to TDR, and has been running quarterly webinars called Virtual Cafes since 2018. Our common goals are the Sustainable Development Goals, and addressing the determinants of health and health equity. And I have been asked to show a little bit more about the regional strategy. So I'm going to focus on three aspects. The first aspect is research and evidence. They are central to SIHI. They are also an opportunity for PAHO to support communities in advancing regional goals through local actions where they're most needed, leaving installed capacities. These two links provide a wealth of resources, and I think Joe is putting them on the chat now, so you can access them. One, of course, is the website for SIHI, and the other one is a collection that we have of the research outputs that have been coming, and the communications and so on that have been coming from the SIHI teams. We share a Sotero open library where research outputs and resources are available for different media, because we acknowledge that people learn and share differently. And therefore, the collection includes a broad range of media, such as, papers, but also podcasts, and there's videos and photos and news pieces. And even there's a Duolingo course describing one of the social innovations that was done by them. So we partnered with the SIHI, SESH, TDR, CIDA, and the BMJ to prepare a special collection with about 24 articles on social innovation that was published last year, and you'll also find the link in the chat. As social innovation evolves, research reporting standards were put forward by SIHI contributors. For example, the CIPHER guidelines to report social innovations were developed with contributions from the SIHI network. In our region, we have been engaging and enhancing, a guideline to be applied by innovators in exchanges. And we released this month an updated virtual course on enhancing the visibility and value of your research with reporting guidelines that is relevant to social innovation reports. And it was developed in collaboration with the Equator Network, which is the global leader on reporting guidelines. We also follow up innovations and learn from their journey. If you check the BMJ Innovation Special Issue, you'll find the stories there. A second strategy is promoting co-creation through participatory approaches. Whether in workshops, meetings among innovators, or field visits, we promote debate and exchange. The Hub seeks to organize exchanges to promote cross-fertilization of ideas and learning by all parts. We learn from example we learn from their example and a situation in which this has been, and we look at how the communities can teach us different things. So there's a lot of listening and exchanging of ideas between innovators, but also with the greater secretariat. For example, we have the innovator exchanges, and we have some where all the innovators have come together, like meeting that we had in Cali just before the pandemic, but we have also had innovator exchanges where some innovators visit other innovators, and the agenda, the conceptual work, and all that is done collaborative. The next one for several innovators is going to take place at the end of October here in Washington, D.C. CDI, which is a TDR training center, offers opportunities to train in implementation research, participatory community-based methods, and many other things. So that comes also into the support that's provided to the innovations. And the third that Mengji was also mentioning was creating an enabling environment. That's our third strategy. For example, through communities of practice and providing communication channels. The Latin American and Caribbean Association for Social Innovation that emerged from SIHI, ALASIS, is called, created by the innovators. These are innovators that participated in crowdsourcing calls, even if not recognized, and they're very active in LinkedIn and WhatsApp groups. SIHI has pulled incredible global and regional partners to support innovation. And these are not all of them, but this gives you an idea of the wealth of support and partners that we might get through the initiative, and the benefit of having a regional and a global network. There are plenty of opportunities for networking, or to apply for grants, or learning, or collaboration, sharing resources. And because resources are developed collaboratively and opportunities are shared with all, we find many engaging initiatives. Perhaps one of the best known elements of the enabling environment are the regional crowdsourcing calls. We have had them every odd year since 2017, and we will soon announce the 2023 finalists. The call had 96 applications. The process and instruments used are refined following each call, and we have an independent selection panel and a due process that's well established. So the criteria and the methods are explicit, and they're continuously being refined. So that's perhaps one of the best known aspects. And I want to wrap up on the key elements of the regionalization strategy, that they involve knowledge and evidence, participation and co-creation, and an enabling environment. So health equity is that's the linchpin for all of this, and that's why we are so interested in being part of this and supporting the initiatives in countries. Thank you. Over to you.
Thanks, Luis Gabriel. That was fantastic. Thank you so much. Now we do have a few moments for questions. And if it's okay with Mengji and Luis Gabriel, I'd like to just go to the chat box. There were several excellent questions. Art had a question about, from the perspective of, or from your perspective, how do you think a potential SIHI hub in country could make a case for social innovation and health to facilitate the engagement of government agencies? Would either, both of you be willing to reflect on that?
Yes. Okay, well, I mean, the engagement of governments, there's so many opportunities. And I was thinking as initiatives evolve, new opportunities arise. And that's where I think we have a great opportunity in where we are. Let me think of an example. As community health workers develop and become part of a workforce, as they have done in the Amazonian basin, for example, where a social initiative grew from covering three small villages to covering over 1,000 kilometers of riverbeds, providing support for clean deliveries and maternal care. This was done through these community health workers, and eventually, as this grows, they'll need to be in a way, supported and certified, and we need to know that this and they need to engage with the health system as a whole. So something that started as something local in a village starts becoming something much bigger. Well, you need to have the engagement of the whole government. As the social innovations evolve, you also find more complexities. I think one key element of the role of what we do is accompanying those, supporting those social innovators. And in those complexities, other levels of government have to participate. In the example I'm bringing up here of the Mamás del Río that work in the Amazonian basin, their work there led to identify that a critical element why it was difficult to get healthcare sometimes was that people were not registered. And because they were not registered, they didn't have their national identification number. That made it more difficult for them to count in many ways, to access services, but also to be counted when someone fell sick or died. So there were not really very good statistics. And a key element that they did was bringing on board a different aspect of government to do all the registration of the population. And that completely changed the picture because now they have data that they didn't have before. And that eased the relationship with the services. So there's many ways in which government can contribute. And I think, I hope that an example illustrates the breadth that this could take and some elements that were unexpected at the beginning when the focus was on teaching technical skills, on developing technical skills locally to have a clean delivery. So it provides that structure and that connection with government institutions.
Thank you. Thanks. Mengji, anything to add there?
Luis did a great job, Gabriel. I think I really should have a separate call with you. We met each other on so many different meetings. But yeah, so the question, I actually want to respond to the question with a different question. What do you mean by making a case? Business case, investment case? Is it a physical, tangible hub, or it's just more like an intangible platform? Because the implication for government is quite different. And also, that's one. And the second is, what do you mean by facilitating the engagement with relevant government agencies? Because I think SIHI Hub, it comes back to the hub's function, the setup itself. Is it intended to be an implementation agency, or it's like a concierge for implementation organizations? So I think it matters because at the end of the day, I think government agencies, when it comes to innovation, whatever type, I think the top thing on top, literally the thing on top of their mind is de-risking themselves. It comes into things. It's cost. What is a cost implication over a relatively longer term instead of just within a year's initial investment? And second is, how much impact can I do with this? So if you're talking about whether the SIHI Hub should make a case, I think the first thing is whether the SIHI Hub can make an investment case and see what is the benefit of government being involved and engaged in this initiative. I think the investment case is something that, I mean, this is just my understanding, don't quote me on this, but I think doing the sort of business model analysis is not the traditional strengths of many social innovators, because many of the social innovations come from a deep understanding and empathy of the problem and the people they want to help. Not really people don't go to business administration MBA courses to be a social entrepreneur. That's different. But I think this is quite something, if you do want to engage the government agency and make the case saying this is useful to set up this hub in this country because of 1, 2, 3. I think you really need to put yourself in government agencies' shoes, what they are thinking about. So I would say, yes, there's always a potential, but we probably should further elaborate the question itself. What exactly you want this hub to serve? And with the current resource, is this something you can serve, or the sort of engagement expectation you want is actually quite different from the skills and resource you can bring to the table for negotiation? Yeah, I'll stop here.
Thank you, Mengji. And these are great points. And Art, who asked the original question, he can unmute and sort of clarify a little bit. Over to you, Art.
Yeah, thank you, Mengji. Those are really important and practical points that you raised. I mean, especially in terms of really getting the government's buy-in to what are you actually subscribing to or for and advocating for. Well, for me, initially, when I ask that, when I'm thinking about that question, it's all about like, how do we ask our leaders, therefore, to subscribe to that more of our conceptual or form of, framework of social innovation, like changing power dynamics and more of that overflow of social innovation benefits, rather than looking at investments first. And like, it's at the end of the day, the bottom line is like, are we saving better or providing more benefits at lower costs, etc. So I think those things should be provided for by evidence first before we can actually allow governments to subscribe to that notion of having that more participatory engagement and hearing more about how can we better engage people for better governance, maybe. Thanks.
So if I understand you correctly, what you essentially want is the government to have the value, or to realize and recognize the value in social innovation, with or without rigorous evidence support. And I suppose the mindset changing is something we all expect. This is actually something we put also in the strategy, the leadership part. I personally don't have an answer to that. What I can say is this is sort of the longest term investment in terms of trying to provide the systematic training. No, let's not call that training, the systematic advice to the leaders so that they actually can see this has its benefit. But I don't see, as far as I know, I don't see much. I don't have an immediate answer, but back to the question itself, this is definitely the thing that you should do in terms of advocacy. But in terms of how to do advocacy, should it be primarily focusing on evidence-based, or it's just a genuine way you communicate through using more influential communication techniques? I think that's the technical part. That's sort of the tactic level. That's fine. I think it's definitely something that's worth doing. But at the high level, strategic level, it seems to me that a hub itself doesn't address that question. But which actually address the question is a question that I cannot answer now. But yeah, I think I should just leave that to Gabriel.
But Mengji, to go
Mengji.
back to your earlier point about de-risking, I mean, I think that's a really nice example where like a government, a public agency wants to see evidence. It wants to see like how I think a SIHI hub could help to de-risk the local environment and make it easier for social innovation to kind of either be developed in the first place or to grow and develop over time.
And the only question I personally have is social innovation, actually technology innovation the same way, is so hyper localized. So how do you create even a measurement framework that works? It's almost like you are evaluating a set of enablers that are working together accidentally at the very beginning. And you try to find a systematic way to upscale it and measure it. It's very different from health technology assessment, which is relatively standard. So I think that's the only challenge, which means, yes, SIHI can definitely do that, except the growth is linear. It's not exponential because of its difficulty in standardization. Yeah, that's my only concern, but I think there's definitely value out there. It's just the value itself is a bit difficult. I feel like it's very difficult because of the hyperlocality of innovation itself. But I guess I would like to Gabriel to step in and just say if there's anything. Yeah.
I want to shift a bit from thinking about economic returns and think about values and principles. And that's one of the reasons why we are so embedded into this, as health equity is a core principle to WHO and to PAHO. It's all about health equity, and in social innovation, grassroots are addressing community need. Frequently one with ramifications. One is that is not simple because otherwise it would have already been addressed. And the innovators appear and bring a perspective on addressing that problem. They become catalysts and they organize with the community, connecting things and aligning efforts. And as the problem and the determinants evolve, the role of the innovators also evolve. And that's a critical element that we can illustrate with a couple of examples, but accompanying that process is part of that enabling work that Mengji that we were raising in our presentations. I think we are well placed to support those transitions and respond to the new roles, the challenges, and deal with those complexities. To providing what is needed so that can be done by the community and the innovators. For example, a community in the rural area of Bogota was dealing with the challenges of malnutrition. They couldn't bring food to the table. They couldn't get good quality food, and they didn't have the income. And the innovators' leadership led them to begin reorganizing their forest and eventually growing organic vegetables. So they had a whole ecosystem recovery, and malnutrition was reduced as they got access to quality meals, and not just the ones that they provided for themselves, but their income grew. So they were in a better position and they had a healthier environment. Throughout the process, the skill sets of that innovator changed. From something very local to actually having to deal with the supermarkets and having to do these negotiations and become an entrepreneur. And I think that shows the complexity of the whole process. And as has happened also, from the example I was giving in the Amazon, from being a community, an indigenous communicator in the community, or from being someone providing a very technical health service of prenatal care, to eventually training cohorts of community health workers and then engaging them with the health system and then getting them to be recognized and so on. Those I think that shows the value and the process of this, and also the engagement they could have with the government.
Thank you. I know we're hitting the 60-minute mark. This has been such a rich discussion. I'd like to ask our panelists if you have one final kind of idea or key strategy for promoting social innovation at the regional level. I'll start with Mengji and then Dr. Cuervo.
So I think in principle, though these are the 4 areas we'll work on with our partners in my slides, but also just based on the discussion in response to the question, I think we ourselves are not supposed to be innovators. WHO is a secretariat of member states. There are plenty of institutions doing innovation out there, but our job is more to think about where to find and cluster health innovation, social innovation, so that they actually can be transferred to other regions, to other member states. And we're just talking about social innovation and hub. So one thing, based on what Gabriel just gave the example, this just remind me about city as the source of social innovation ecosystem. So if you think about the challenge of institutionalizing social innovation at a national scale, yes, of course, because of hyperlocality, but if we think of city as the source as well as engine of social innovation, and we just incubate it within the city level, and if we can manage to decentralize the governance from the national level to district or city level, I think it will be much easier for us it will be much easier, and we should be able to see more innovation examples that we can document and amplify. So for me, that's just one additional entry point that I just thought about based on the discussion here. But yeah, in general, the strategy itself has covered it all. So please stay tuned when the strategy document becomes a production at the end of this year.
Thank you, Mengji. Over to you, Dr. Cuervo.
Thank you. Well, I think the key element is, and I was talking about the federalist approach, basically becoming an enabler, having organizations that are enablers that help connect the dots, that bring different stakeholders to the table. But the innovations are done by the innovators, and I think the role is that one of supporting them and supporting having that enabling environment or ecosystem for social innovation being strengthened throughout the regions and globally. And that sharing of resources, I think it brings a lot of efficiencies, having standards and so on.
Great, thank you. Well, thank you both again. This was a really rich and exciting dialogue, and this was live streamed. It's also going to be archived, thanks to our SIHI Secretariat, and also to Yusha Tao and our SESH team for helping to organize. I think there's still a few lingering questions. If folks want to stay on and chat afterwards, the link will be open. The recording will probably stop. But thanks again to everyone, and have a great weekend.
Thank you. Have a great night.